Hello to everyone. I hope I'm audible, visible. Hello, hello, hello. How are you all? If I'm audible, visible, please give me a signal so that I can start. If I'm audible, visible, please give me a. Yeah, I can see. So, hello, how are you all? So, I'm not in Delhi, I'm in Calicut, and I am here just to discuss with all of you what is the progress going on. Hello, Nikita, how are you? Let's wait for other people to also join in. Yeah. Hello, Dr. Binnu, BTS Army. क्या बात है? So, how are you all? I'm good. I'm doing well, as you can see. Uh, okay, as always. I'm in my hotel room. I just came from the class and I just started the session. Hello, doctor. Good evening to everyone. So basically, this session is about all the students who are, part of our journey toward the FMG exam. So this will be discussing all the issues you are facing and what could be the possible solutions for these kind of problems. Okay. So that's why I don't have to say anything else. I just say one thing. Please remember that we are in the middle of the journey. 3 months are gone. 3 months are left. The exam will be first week of July, as already there was a notification that the eligibility certificates are to be prepared, and the yes, the values and the exam will start in the yes, the forms will come by the May month. And in the May month, you will be getting all your what do you say? The forms will be coming, and you can apply for the exam. So what I am planning to say and discuss is basically what to do in the remaining 3 months. Okay. So let's start with a very basic idea. So what you should have done by now. So you should have done at least seven subjects, 7 to 8, best if nine, if not at least seven subjects should have been over by now, because in 3 months you have to finish all the remaining subject. Okay, at least in 1.5 month, and the remaining 1.5 month you have to finish for your revision. So that's my perfect plan. So 45 day you can spend to finish all 19 subject. Remaining 45 day you have to spend for your revisions. Okay, and revision should be done in a such a way that is incorporating your PYQ based learning. Okay, so very soon we'll be giving you what do you say, a material which is for revision. Right now use your own notes for the classes and the revision. No need to change your source. Whatever source you have is more than sufficient. So anyone who would like to say anything, they can say now. So I will just give you the guideline. The guideline number one is you make sure that whatever subject you have done, they are done. Do not repeat them in the next 1.5 month. After 1.5 month, that is by mid of the May month. Okay, mid of May, you have to start your revisions. Okay, and revision you start with the small subjects. Okay, so I'll give a very soon list of the test and discussion and the revisions we'll be having in the NLC. Okay, live online offline batch, so you people can follow that routine. Plus we'll be having the expected question sessions starting same time, that is in the May month. I'll be starting expected question as the subject wise test and discussions are going on. Okay, yeah. So anything you want to ask, you can ask me. I will help you. And discussions are going on. Yeah, anything you want to ask me, yeah, you can ask me by messaging in the chat box. I'll be replying to you. Yes. Dr. Raju, Dr. Nikita, Dr. Binu, anything? Yeah, please message me so that I can reply to you people. Okay. Okay, sure. So I'll be taking the queries. The first query is Dr. V Medicine, how to study biochemistry. I'll tell you, biochemistry is such a volatile subject. You cannot do so. I'll request you do PYQs and RR. Okay, so you can use the race notes for the revision, or the notes given by any of the faculty for biochemistry. Dr. Ankur is also very good. Then there are other faculty in other platform. Biochemistry, you don't have to worry much about the in-depth. Main is vitamins, the enzyme, rate limiting, and the diseases, the main diseases. Like they will always be asking about the Leishman, so do it very properly. Then our syndromes, which are this Von Garrix, okay, Coris, these ones are important. Just do that, and yes, ignore others, okay. RR is sufficient for revision for all 19 subjects once you've done the main subject with main classes. I told you already, physiopatho pharma, then medicine, OBG, surgery, PSM, ENT, optha, pediatrics. These 10 please do from main classes, main video. Other 19 subject, once for revision you can do RR. 9 subject like anatomy, micro, biochemistry, this psychiatry, anesthesia, even if you do them from the RR in the beginning also, it's sufficient. But for physio, patho, not doing the subject properly, just doing RR is a mistake. It will not be sufficient. How to complete subjects? So I told you, don't do all 19 subjects from the main classes. You can do this 10 subject: physiopatho pharma, medicine, surgery, OBG, and PSM, and with ENT, orthopediatric. These 10 do from main classes. It will take hardly 40-45 days. Even if you start now, okay, 4 to 5 days each, it'll take 10 days and you can finish 45 days. And then you can do other subject in RR, okay. Next, RR, I told you already. Good evening, Dr. Kandesh. For anesthesia, yes, RR PYQs are more than sufficient. Revisions, I think, Dr. Yepthomi, I will advise you should start the revision in our May mid onwards. Okay, till May mid, you finish all your subject main videos or whatever source, but please try to start revision. If you've done all the 19, you can start revision now itself. Okay. Next question, Dr. Avdesh. Subject complete. See, MCQs you can do immediately after the subject, especially the subject test you can give. PYQs you can do later with the RR itself. Till now 12. It's very good. Okay, don't worry. Okay, you're doing perfectly. Yeah, daily 100 is more than sufficient, Abhishek. Keep this rate and keep the question. Later you can increase the question to 150, 200 once you've done all the 19 subjects. Very good. It's harder to stay consistent. So I'll tell you, first is don't look at you remember or not. Journey is important. Like keep studying, keep revising. Don't think, am I revising it? Am I reaching? Because when you start looking at the outcome, in current state you cannot remember. Like even I sometimes cannot remember what I said or what I will do tomorrow. Where's my key? Where's my passport? But is it there in my house? Yes, the passport is there. My key is there. My mobile phone, yes, I lost my mobile phone once, but a mobile phone is there in my house. I will just need to search. Okay, I'm searching. This is my remote. Sometimes I cannot find the remote, but that doesn't mean the remote is lost. So that's why most of the information is there in the brain somewhere. So just keep studying. Don't worry about the recall. It will be recalled later. Just follow the 19 subject, do the PYQs, do the question, and then you don't worry about the outcome. For the correct method of revision, I told you the correct method of revision is only study the main material and highlight that. Like example, if you are revising, let's say medicine ECG, so only the important ECGs you revise. Like this is straight line, that is asystole, cardiac arrest, do CPR, adrenaline. If there is a earthquake like that is fibrillation. What do you need to do? Defibrillation. So like this you remember. Sawtooth, okay, it's flutter. So you remember now not by the theory but by the outcome. Revision should be outcome based. Like in disease, let's say myasthenia gravis. Now don't study myasthenia gravis autoimmune disease. This now myasthenia gravis, autoimmune type. Which one? Hypersensitivity. Type 2 hypersensitivity, antibody against the receptor, flaccid paralysis, start with ptosis, diplopia, and then go down like this. Okay. So this will help you remember the revision effectively. Okay. Which start the revisions. Okay, Kana, the revisions are starting in the May month, I told you. So you people can join and start from the May month for revision. Till then, keep attending. NLC student, please stick to your syllabus. Your syllabus will be over by 15th of May. Then we can start the revision together, TND together. So don't have to go anywhere. Okay, Kana? Yeah. Completing theory part, I am doing PYQ. It seems, yeah, obviously, yeah. See, if you are finding it, that means you actually are studying. Not remembering is a sign that you did study. If you would have studied multiple time, okay, then also you can forget. So best is keep doing it. Don't worry much. PYQs, you can keep it for revision time. Right now, just do the subject based test. Like example, physiology is over. There's a 100 question test. Give the test and don't worry too much about the PYQs. We'll do it later. Okay. Doctor, I cannot finish subject only four. Don't worry, okay. Whatever you've done, see, not all have same speed. Some people run very fast, some run very slow. Remember the story of tortoise and the hare? Speed is not the thing. The thing is, are you able to maintain that? If you maintain even at this speed, you can finish 8 subject, 9, do at least 10, 12 subject by mid of the May. And then other subject you do by RR. Okay, doctor? But don't be negative. Yeah, ortho radiology Kandesh, RR chanting is sufficient. No need to go for main notes because these subjects are small and they don't have to have anything about the detailed studies. Okay. Yeah. Baki remain positive. I told you I am there. From May onwards, I will be starting. Abhishek, I'll be starting from the yes middle. And once I start, I will make sure to revise all 19 subject, all the expected question. They will be more than sufficient. I request you, you people study to get 100 marks. 100 marks you get. 50 marks I will get you. 150 you will pass. So your target is very simple. Anyhow, study this much. You can get 100. Can you people get 100 marks by your own efforts? Just tell me yes or no in the chat box. Kana, I'll tell you, okay, the 5 small subject, anesthesia, psychiatry, radio, okay, then this derma and this, what do you say, radio, ortho, psychiatry, derma, and anesthesia, psychiatry. These 5 you do by RR, anat, biochem, micro, okay, and you can do the remaining is FMT also from the RR. These 19 you can do by this 9 you can do with RR. Physio, patho, pharma, triple fee. Then big subject, medicine, surgery, OBG, PSM, 4 big, and 3 ENT, optha, pediatrics. That you need to do by main subject. Don't do them RR. RR will not be sufficient to cover optha ENT. You will then suffer. ENT is very scoring. It give you 10 to 12 questions directly. Do proper now. Why doing RR for that? Okay. So that's not telling you. Okay. Don't worry at all. I will be covering 50 marks. 100 you, 150 you will surely pass. I should do live classes and non-class day. Marcel, it's a good plan. Please do the revision. Whenever there's a free day, do the revision of that subject which is going on. Don't try to put anything random in between. Okay, go as per the schedule. And whenever you get freedom, see after 15th May there'll be no classes, only TND and revision, and you'll get ample time to cover any missed subject. Let's say you missed a subject of anatomy physio, do them in the revision time and you can do them from RR. That time you can do physio from me. I'll revise entire physio in 8 hours and it'll be as good as doing the whole subject. So don't worry about my subjects, okay? Dr. Rajat, should I watch the RR video that no. You don't have to go line by line. I told you just do the important lines which are there, like the summary. RR should be a summary, okay? And after that you can do the questions. It will be very effective. Main video, main class, and then questions are difficult. Better you do the main video, wait for the RR and the chanting, then do the questions. It'll be easier. Vinu, sir, please make timetable. Okay, sure, I'll share it. Don't worry about that because we are just trying to finish all the 19 subject by middle of the May. Then we can start with the revision chantings. Can I do old session pharma? Okay, you can do my old pharma is as good as new one. But main thing is do the revisions afterward. Okay. Kandesh, I study. Yes, thank you very much, Dr. Kandesh. And do attend the revision sessions. It will be very beneficial and make all of you pass the exam. Okay. Any other doubt you people have? Because I told you, just trust me. I'll be covering 50 plus question this time for sure. Last time people said 30 question came or whatever, 40 question came. This time I will cover 50 plus, maybe 60, maybe 70. But I need your support. I cannot cover 150 alone. It's like never ever will be the case कि all 150 came from my session. Even if they come, I will refuse. I will say no. 150 never came. Maybe 50, maybe 60. So that's why I want you to cover the remaining questions. Okay. Thank you, doctor. Thank you for your regards. Dr. Khara, I hope I'll be able to do that separately for NEET PG. I'll be taking revision sessions for NEET PG also in the month of May and June. You can watch it for NEET PG also. Okay, Dr. Yes, KHRA. Any other doubt, any other thing you want to ask, you can just tell me. I'll be helping you do that clearly. Okay. So all those students who are watching me, my only message to you people is right now, don't worry about the result. Clear? Because that is going to just give you a negative feedback. Okay. Clear? And don't feel pressurized. Pressure, you don't know what pressure is. Pressure is onto a poor person. Okay. Who has to find a job, feed his children, pay school fee. He is in pressure. Pressure is a poor mother who has to, take care of her children. She is working as a housemaid. She has to earn money. Husband is not there. That is pressure. You people have just one thing, study and just clear the exam. Pressure is look at those people who are at the border. Recently, also, five our soldiers were killed in terrorist attacks. So that is pressure, yeah. Our life is much more comfortable. I'm sitting in a AC hotel and talking to people. You sitting in your rooms and you're studying. You have books, just study. Please don't take negativity. Oh, our life is so shit. Your life is very good. Okay, you are just one step away from becoming a doctor, earning good salary. Okay, just one step. Just 3 months, and you will be a doctor. You don't need to just study. I told you, study yourself. I will get you 150 plus. Okay, Dr. Rajat, I'll tell you. Okay, first, that's why it's there. Okay, don't think anything. Whenever you find distraction, okay, wear a rubber band. Okay, tight rubber band. Whenever you find any kind of distraction, pull the rubber band and make it strike. It causes negative reinforcement and always make you focus. I used to do that. Whenever I'll feel, I'll stop my breath. I know it's very, I'll stop my breath and I will keep on studying. And when I become very breathless, so suddenly I will get distracted. So need to distract your brain from negative thoughts. Okay. Thank you, Dr. Bini. Thank you. Thank you. Yeah. Dr. Rajat, I am, yeah, PYQ. Yeah. See, I told you, okay, the follow that plan, Dr. Rajesh, which I am giving you, that is much better rather than, worrying about the custom module. Go subject wise. Don't try to create different combos. Combos are not good. Try to study subject wise. Do the subject, do the RR, do the PYQs. That's it. Dr. Pasha, complete course. Yeah, there is a complete course of physio medicine. You can do it. I will share the number in the chat. You can write and message this number. They will help you in getting the, yes, the classes 3687. So this is the number. You people please contact here. Okay. Okay, Dr. Abhishek. Yeah, you can change the source. Okay, see, too much change is not good. Like people study two subject from here, two they study from there. Like ऐसे पढ़ेंगे, थोड़ा सा यहाँ से पढ़ लें, थोड़ा सा 3 ऐप, 4th ऐप, 5th 6 ऐप्स दे आर स्टडिंग. इनफैक्ट ऑल द ऐप, मतलब ऐसा है कि याली मैडम के लेक्चर तो ओबीजी हो गया, तो याली है ना, वो जो ऐप से ले लिया है ना, जिसमें आरबीसी बनते हैं वाला है ना. फिर ये के लिए अपन उससे पढ़ेंगे, वाली मैम नहीं है जो माइक्रो पैथो वाली. अच्छा, एनाटॉमी दैट सर इज देयर, उससे पढ़ेंगे. अच्छा, अब फिजियो वो तो आशीष सर से पढ़नी है, उनसे पढ़ लेंगे. भाई दे हैव टेकन 6 ऐप. 6 ऐप से पढ़ रहे हो यार आप. फार्मा वो वाले सर आते हैं, फार्मा वाले, उनसे. ओ भाई क्यों कर रहे हो यार, मतलब इट्स टू मच यार. टेक वन सोर्स, 3 4 sources. You are completely creating a like confusion. Okay, please don't that. Okay, Mano one test series. See, I'll tell you, for mock test, the good score is 160 plus. Any score in 160, 170 is very good. But I'll request you not to give mock now. Give the mock test, full mock test after May 15, and you can do now mini mock test like 100 or 150 questions. Most welcome. Parthiv, you can do my revision of Optha, and my full Optha is available on YouTube. You can search Ophthalmology Dr. Ashish. There are 6 lectures, you can watch them, 6 lectures. And there are 2 lecture revisions, you can watch them. Hello, Dr. Priyanka, how are you? How are you all doing? So I told you my simple plan is you people study whatever you are. Don't worry anything about the result, outcome, what I am studying. Just focus on one thing. There's an exam and I have to give the exam in the, yes, first week of July. Ashish sir said he will take care of 50 question, 100 question I have to take care. So let's study for 100. Even if you give the exam now, na, you'll get 100. So why are you thinking about the negativity? Okay. Okay, Dr. Marcel, you are thinking 150 finish. Okay, so I'll tell you, best is do questions from the subject you have done. Don't try to rush after, like any live topic, this rush after the subject. So I always say right now, don't try to do 100 question per day. Rather, after subject is over, do 100 questions of that subject. Okay, rather than running after all daily 100, it's not possible. Okay, you can ignore that. I'll try, Dr. Kandesh, about this 200 plus MCQ, because my target is chanting. After chanting of mine, then do the PYQs. Dr. Manu, okay. See, don't worry about that. Okay. Marrow Q Bank is not a representative of the actual exam, neither is NLC Q Bank. NB is a different level thing. Okay. NB is like, sometimes I've seen people who get this mark in the Marrow prep, they get more marks in the actual exam. Some who are getting less in NLC Q Bank, they get more in that. So that's why it's not a true indicator, right? All question bank have their own strength and weakness. Okay. So you cannot predict. It's like a, like, it's like a cricket match. Someday even Afghanistan can beat uh, Australia, and someday what can happen. So that's why don't worry too much about the different Q banks. I'll advise you, the main focus should be FMG Q bank first, and then 5 year NEET PG. Ignore INI-CT. INI-CT should not be done. Amisha Mondal, chalo yaar, congratulations. Okay, you pass, and I wish you my best wishes. Work hard, get a PG seat, and all of us wish you best of luck once again. Kana, you can do two subjects. That's not a problem. In fact, at a time you have to do three, four subjects. Like when I do revision of minor subject, in 2 day I say revise all 5 subjects. I myself do 3 subjects in 1 day, like anesthesia, psychiatry, and derma. I revise in 1 day, 1 hour session. So you can do multiple subjects, but don't try to medicine with surgery. यार वो ज़्यादा हो जाएगा ना. Medicine, give 1 day or 2 day. Like if you're doing first revision, 2 day. Next last revision in the last 15 day, 1 day finish all of the medicine. So 3 revision we say. First is main class, 7-8 days. Like from 1st to 8 April, there is medicine. Then do a revision RR for 2 day, medicine 2 day. And then we can do whole medicine in 5-6 hours. That is a super fast revision in the end. Okay, Kana? Yeah. Mano, most welcome for medicine class. Let's meet all of us on 30th of March. I'll be having the first medicine class with orientation, and then 31st, first, second, we'll be having Deni class. Okay, yeah. Chalo, any other doubt you can ask? I'm there for you. You can ask me. Then I'll wrap up the session. I'll have some food. Yeah. Don't worry, Priyanka. Okay. See, I told na, do to best of your capability. Clear? In the end, we will cover up. I'll tell you. Okay. That is what we always have. Remember, in the school, the parents will say, you do your level best. Like you want to collect the money. Okay. You are collecting money for some project. Okay. Let's say 1,000 rupee. You only collect 100 rupee, 200. In the end, your papa, mama, brother, uncles, they will come teacher and they will add the remaining money. Remember that story? So same way, you have to collect 150 marks. You collect whatever you can do. Remaining I will add from my side. Okay, so that's why don't take negativity. Okay, just be positive. I will do from my side, you just do from your side. Okay, together we'll get 150 plus. Okay, Priyanka. OBG, you do regular class. Okay, Kandesh, don't do RR, do proper class is important. Yeah, you can change from offline from online. It's not a bad idea. You can shift to the city you want to do the class and study properly. In fact, offline is very effective if done properly. Which topic are we starting? We'll do acid base and endocrinology, and then we'll start with the cardio. And this cardio is the longest. It take at least 20 hours. Dr. Raju, thank you very much. MCQ only one source: NLC Q Bank, NLC Q Bank, NLC Q Bank. Again, I'll tell you, some students have passed without giving exam also. Okay, clear? They pass the exam. They don't give the exam. They directly get the passing certificate. So that's why there are so many stories. Some have become doctor not even going. Like in Rajasthan, they directly, people who are 12th fail, they directly become doctor. Not just doctor, MS Obs Gynae. The registrar in Rajasthan Medical Council, he was directly giving registration without degree. So they pass one level, not even going to college. So obviously, some people can pass without medicine also. Some can pass without studying any subject also. That's possible. Yeah. So please don't take this. Take surgery, medicine, OBG properly, please. Okay. Pediatrics, yeah, it can be covered in RR also. It can be covered in medicine, biochemistry also. Pediatrics is covered multiple places. Okay. So don't worry about that. Okay. Okay, Marcel. Yeah. Anod Biochem, I told you you can do from RR and revision in the end, so don't worry at all. Just do to best of your capability. Okay. Okay, Mano? Chalo. So I think I'll wrap up the session. Thank you very much to all of you for coming. Yeah. See, OBG, anesthesia, okay, all subjects are good, so don't worry at all. Okay. All teachers are good. Like pediatrics is also going on. Doctor, this also. I am in Calicut, Kerala. So all teachers are good. I don't think any teacher who's bad. All teachers are good. And I believe that we have to give our best to clear the exam. Chalo. So thank you very much. Thank you to all of you. Thank you. Yeah, I'll have my food. And yes, very soon I'll be seeing and meeting you people again. Chalo, take care. Bye bye. And so nice to all of you for yes, studying and yes, reading here. Okay, chalo. So I'll end the session. Thank you very much. I'm always there with you. Yeah. Okay, okay. Jamie, I'll tell them, okay, not to use Hindi much. Yeah. Actually, point is that some teacher, they go in flow. Okay. So the flow, they start speaking Hindi. Okay. Don't worry. Okay. But teaching is all notes, etc. in English. Okay. Yeah, I'm always there with you. Okay, chalo. So take care. Thank you very much. And we are having Eid very soon. So Eid Mubarak to all the students. Okay. And very soon we'll have more session, more classes. Take care. Bye bye. I'll end the session. Take care. Love you all. Thank you for trusting NLC and being with me. And we will make sure you all clear the exam. Take care. Bye bye. Bye bye.